I mean, I still believe that the concept of herd immunity could be valid, right? If we get enough people vaccinated, there are those who, with some level of protection from natural infection, will end what we're going through now. Now, it may be true that, coronavirus, this is not a new coronavirus, or sorry, this is a new coronavirus, but coronavirus is not new, right? So some version of this may be around, and maybe it becomes something that you get an annual, shot for, like the flu, perhaps. But I think the way that you get there is sort of getting our arms around the current version of it. And if we can do that, then yes, there may continue to be some background level. But once you reach a point where everybody has some level of immunity to it, you don't get these big flares and sort of the spikes in infections. And the overall level of immunity will prevent the severe disease, right? Most people get a cold, don't end up in the hospital, right? They've got some level of immunity to some version of coronavirus that they had in the past that may not be the one that's giving you the cold, but it's enough similar that you can kind of fight it off and you don't get severe illness. The reason that new infections cause such havoc is people don't have that baseline level of immunity to something similar. And so that's what's been happening with coronavirus. And if we can get enough people kind of baseline protected, then yeah, it sort of fades into something that's around as a nuisance, but not sort of the national health crisis that it is today. Hopefully, we may reach a point where you get an annual shot, but it's not killing people, or it's not killing large numbers of people as it is today. And that's sort of where we may get. Now, the worst case scenario we talked about a moment ago when we were talking about Lambda, or whatever the one after Lambda may be, if it truly evades and changes enough that it's not susceptible to that baseline level of protection that those who are vaccinated or those who've had it naturally may have, then you're chasing your tail. But the good news is, again, we've got a technology platform in the mRNA vaccines that we've never had in the past. And they can tweak and adjust those vaccines more rapidly than the tech used for the Johnson & Johnson, right? That's a more traditional vaccine technology, but it takes a lot of time. You have to actually grow virus in medium, which actually is very difficult to do, right? You have to sort of grow it in bacterial cells. It's challenging and it takes time, versus the mRNA, which is kind of like you tweak the recipe and you print a bunch more of it. And so the mRNA vaccines can be replicated far more rapidly. And so if we have to, and we sort of do need to continue to create new versions of it, I am personally optimistic that we'll be able to do it, but it'll be expensive, it'll be time consuming, it'll be a big public health effort to do that if we have to, if we really have new variants that continue to make people very sick. But if we reach that level of herd immunity, I think what we do is we prevent the severe illness. We may not prevent infections, but we prevent the severe illness, and then it just becomes something that is more like a cold than something that's going to put you in the ICU.